See, as you already know, bile salt, it can be found in feces, right? 0.5 gram per day, very small amount. So this is normal, okay, but in urine it will not be there. Bile salt will not be there in normal urine. However, in abnormal urine, if you detect bile salt, it means there could be obstructive jaundice. Fine. So remember, feces normally will have bile salt but not urine. If urine has bile salt, there is obstructive jaundice. Now what happens if feces, let's come to feces and study feces, and let us say feces has excess fat. Then you can say that fat digestion has some problem or fat absorption has some problem. That is indicating a problem with lot of things, could be with bile salt. Okay, if fat is excess in feces, then the problem could be with bile salt. Problem actually is with digestion and absorption of fat, and it could be absence of bile or bile salt. Now another clinical aspect that we would like to give you here is, it is cholelithiasis, that is cholesterol crystals in gallbladder. Okay, cholelithiasis. So basically the bile salts, are responsible for keeping the cholesterol soluble. In bile juice you have cholesterol also. Okay, so that cholesterol has to be in soluble state, and bile salts and phospholipids help. See, let me write here some details. Bile has cholesterol. Okay, now bile salts and phospholipids help the cholesterol be in soluble state. Okay, bile salts and phospholipids are going to keep the cholesterol in soluble state. But if there is deficiency of this bile salts or phospholipids, particularly it is bile salts, if it is deficient, then these cholesterol crystals will accumulate in the, or they will precipitate in the gallbladder, leading to cholelithiasis. Now why bile salts could be less? Because the bile salts, they're not being sent back to the liver from the intestine, could be that, or liver is not working properly, or there's some obstruction of bile tract. All these could be the reasons. Now what are the treatments? This you need to know. You're going to administer bile acid, okay, as a treatment for this person who has deficiency of bile salt. You're going to administer bile acid, and here the example they have given is chenodeoxycholic acid. Chenodeoxycholic acid. This is commonly known as chenodiol. Okay, chenodiol is going to be the treatment for cholelithiasis. What is the treatment for cholelithiasis? Chenodiol. So you are going to administer bile acid, that is going to convert into bile salt and help in maintaining cholesterol in soluble state, and hence it will reduce, to some extent it will reduce the cholelithiasis. However, if the cholelithiasis or the cholesterol crystals in gallbladder or cholesterol gallstones disease, if it is in severe form, then you will have to surgically remove the gallbladder. Okay, so first you can give in mild state you can give chenodiol. Fine. So we saw some clinical aspects of bile salt in this video. Normally feces can have bile salt, however urine will not have bile salt. If there is excess fat in feces, there is some problem with the absorption and digestion and absorption of fat, could be a problem with bile salt. Abnormal urine will have, if it has bile salt, then it could be obstructive jaundice. Another clinical aspect is cholelithiasis, where there are cholesterol crystals in gallbladder. The treatment is chenodiol. Say chenodiol, chenodiol, chenodiol. Bye.